decided to have this press conference with you because of the seriousness with which we view the second wave of this pandemic. You recall that the first case of COVID-19 was reported in Edo State on the 23rd of March this year, and immediately after that report, we sprang into action, constituted a committee, a state committee, a technical committee, to plan our response to this pandemic. Our strategy then, as it is now, was built on collaboration so that we could utilize all the available resources in the healthcare system available in Edo State to respond to this crisis. We partnered with the University of Benin Teaching Hospital, the ERA Specialist Teaching Hospital, which is a center of excellence for infectious diseases, partnered with the WHO, NCDC, the African CDC, private practitioners, and a whole host of other operators in the healthcare system in Edo State. This partnership helped us pull together resources, both material and the badly needed human capacity. With these resources, we were able to plan and execute a very effective response to the first wave of this pandemic. You recall that we did produce an epidemiological curve for COVID-19 as at then, with the assistance of the University of Benin Teaching Hospital led by Dr. Greg Okobo. That model predicted that the first wave was going to peak around late June or early July, and true to that model, that was what happened. That model also predicted that there could be another wave of this infection. And so even though we are having to deal with the second wave, it was not unpredicted. It was not something that we did not consider was possibly going to happen. The second wave of COVID-19 is here with us, but this wave of this virus is slightly, not just slightly, is very different from the first wave. The second wave started effectively about the first week of December. So we're about 6 weeks into the second wave. And from the data we have in front of us, we have witnessed an 84.5% rise in the number of infected persons compared to the same period during the first wave. We have also seen a 10.5% increase in the number of older people who are infected with COVID-19. Even though it's still early days, we have evidence that suggests that more elderly people may be affected. Unlike the first wave, where the virus was mainly imported, it started with people bringing it from outside of the state. This time around, we're noticing that there is more community infection. That is, the virus is here with us, has been here with us, and this second wave is being driven largely by community infections. There's been a 13.9% increase in community infections community transmissions, compared to what we saw during the first wave. Another area of concern to us about this second wave is that we are now seeing more children and youths being infected, and they account for the largest transmitters of this virus at this point in time. As at yesterday, or in fact yesterday alone, we had 46 new cases of COVID-19, bringing the total confirmed cases in Edo State to 3,189. Since the second wave started, There has been sustained daily increase in the number of confirmed cases of this virus. In fact, in the last 46 days alone, Edo State has recorded 493 cases, 193 new cases, and out of which 214 recovered, and unfortunately, 12 people have died. The widespread non-compliance by our citizens has been largely responsible for this increased spread during the second wave. A lot of people seem to still have this misconception that COVID is for the elite or it's for urban dwellers. But from the evidence we're seeing in Edo during this second wave, which gives us quite a bit of concern, we're seeing transmission in areas outside of where the traditional urban areas where we saw spread during the first wave. Whereas during the first wave, it was the epicenter was Oredo, Ikobaka, and Ego. We did not see much in terms of transmission in other areas of the state. But with this wave, we're now seeing a widespread transmission across the state, particularly in Eastern West and Eastern Central and in Issaquah West. So it is no longer an urban epidemic, it's now a pandemic, it's now statewide. We, as a state, are confident because of some of the accomplishments that we have achieved during the first wave. We, as you recall, had strengthened collaboration with institutions who have supported our fight against the virus. We have built capacity, the human capacity to respond to this virus by improving the skills of our healthcare workers through regular training and retraining. We have a very well-coordinated surveillance system across the 18 local governments of Edo State, including the exit and entry points into and from the state. As government, and with the assistance of international agencies and federal government, we have continued to provide the needed resources to fight this pandemic. We have provided funding and platforms for setting up 3 additional molecular laboratory testing centers. We have 3 centers in Benin City alone, and 1 center in Irua. So we have a COVID testing capacity in Edo State today that can do as much as 600 tests every day. We have continued to procure laboratory and other commodities which are essential for supporting our COVID-19 response, such as PPEs, personal protective equipment, ventilators, dialysis machines, PCR reagents, and logistics and vehicles necessary to move people back and forth. As a state, we have been commended by the Federal Ministry of Health for our home care-based program for patients of COVID-19, realizing that if the infection goes as predicted, we may not have enough hospital beds to cope with the incidents and the patients from COVID-19. We've decided to develop a protocol which has now been applauded and studied by the federal government to help patients be treated at home under very strict supervision. That only critical cases or cases that cross a certain benchmarks are brought into the isolation centers that we have. Gentlemen of the press, how have we decided to respond specifically in Edo State to this second wave of COVID-19? This time around, we are emphasizing communication. We are emphasizing risk communication and education and also compliance. Because individuals, organizations, and groups must accept responsibility. Except they do, we will continue to see a spread of this virus. We will enforce our guidelines, and when we find anybody, no matter how highly placed, that's in breach of the COVID-19 guidelines and protocols, we will ensure that those guidelines are enforced. As a general advice, we are telling all Edo citizens that please, when you think of COVID, think of 3 C's. First C is that you should avoid closed spaces. In as much as possible, don't have meetings or gatherings in closed spaces, except you have to. Even when you're outside, avoid crowded places, because this virus gets transmitted when you're in close proximity with people. And then the last C is avoid close contact with people, even when you are outside. So the 3 C's are avoiding closed spaces, crowded places, and close contact. If we do this, the virus may not infect us. We, unlike the first wave, will not just rely alone on creating incentives and encouraging people not to. If we find you flouting any of the regulations, if we find you not wearing your face mask, we have put in place the enforcement mechanism to make sure that you are compelled to comply. We have put in place enforcement teams, and you'll be seeing them going around the city and communities. And once we get a report or we find out that anyone is breaching the regulations, we will effectively ensure that you not only comply, and if necessary, you will be charged and convicted. The fines are there. You will, even though you will not be taken to prison, you will be compelled and made to undertake community service, and it will go into your record that you are an ex-convict. We also, as part of reducing the amount of movements around the city and around the state, we have decided to review our curfew period in Edo State. The curfew in Edo State will now start at 10 p.m. and end at 5 a.m. from today. The Christian Association of Nigeria Edo State branch already has a COVID-19 monitoring committee in place. And that committee is going to be working very closely with our enforcement teams to go around to make sure that all places of worship comply with the protocols, and that nobody will be allowed into any place of worship if they are not wearing a face mask. And that every place of worship must have running water and liquid soap and hand-based sanitizers at their entry points. That they will all conduct temperature checks at entry points. We have also agreed with them, just like with every other segment, that every space of worship, every hall, can only accommodate up to a maximum of 30% of its originally designed capacity. Services should not last more than 1 hour, because research has shown that the longer people stay together in a place, in an enclosure, the higher the likelihood of the virus spreading. Because our research has now shown that unlike in the first wave, with this second wave, we're seeing more infections of children under the age of 10. In the first wave, that was not so apparent. But this time around, we're seeing a higher infection rate amongst very young children. As a result, we've agreed with the religious leaders that children under the age of 12 and adults above the age of 60 should be encouraged to stay at home for now and not go to places of worship. In the case of schools, we have decided in Edo State that schools will not reopen for now. This situation will be reviewed by February 1st. We would like schools to reopen on February 1st, depending on the situation at that point in time. But between now and February 1st, we're going around all the schools to make sure that they have running water, that the spacing for the students are in place. We want to ensure that we have temperature check facilities at every point, in the school, to ensure also that we can plan plan sitting in schools, because each classroom should not hold more than 30% of the children. So all of that is being worked on by the Ministry of Education and SUBEB. And we hope within the next 2 weeks we'll finalize what mitigants we have put in place to allow children go to school. For markets and shops, we will not relocate markets as we did the first time, during the first wave. We will work with market associations to ensure continuing decontamination of markets. That is, that we'll decontaminate markets on an ongoing basis. That all markets and places or shops must have hand washing stations with running water and liquid soap. We are going to be working with the market leaders and our enforcement team to ensure compliance. There will be no mask, no entry policy in every market and in every store in Edo State. Anybody found not to be complying with these measures will have to face the consequences. We'll have no hesitation whatsoever to shut down, close any markets or any store when we find people not complying with this protocol. The COVID-19 spreads when people move. So the transportation sector is one area where we've noticed that encourages the spread of COVID-19. While we are not going to be locking down and limiting the transportation activities, it will now be the responsibility of every driver and conductor in the bus to ensure that everybody wears a mask. Nobody will be allowed into any public transport, whether it's an Okada, a motorbike, or a taxi or a bus, without putting on your face mask. For hotels, lounges, bars, and restaurants, we will ensure that there's a strict enforcement and observance of no face mask, no entry policy. And just like with every other sector, there must be hand washing stations in every restaurant, lounge, or bar. We want to encourage no sit-ins in restaurants and to encourage restaurant owners to provide takeaway services, because you will not be allowed to sit more than 30% of the people you normally sit in your spaces. So restaurant owners were encouraged and being encouraged to provide more takeaway services so that people can buy food and take to their homes and eat their food at home. For social gatherings such as weddings, anniversaries, funerals, etc., we are encouraging people to reduce the number of invitees to these events. As much as possible, particularly because it's dry season, try and have your events outdoors. If you have to hold events indoors, then those venues cannot occupy more than 30% of the capacity of those venues. For the civil service, the same principles apply, and we will institute an alternate week scheduling for all cadre of staff so that we can achieve the 30% maximum rule. We will limit in-person meetings, except it's absolutely necessary. We will not be hosting physical meetings in government. We have installed the appropriate technologies, and we are encouraging our officers to host Zoom meetings or electronic meetings, as these will still achieve the same effects as physical meetings. For public servants must serve as the model for compliance, because you represent government and people are looking up to you to set the direction. Once again, I want to thank all the citizens of Edo State for the journey so far. Our lives and the lives of our people are at stake. If you are wearing a mask and the other person is not wearing a mask, you are still exposed. So it is in your interest to make sure that before people talk to you, before people come close to you, that they should wear their masks. If you remember nothing else, remember that you hold your life in your hands. Nobody else holds your life. So it is in your interest to protect your life. Wash those hands.